For generations, medicine has often been a reactive field. A patient feels a lump, develops a persistent cough, or experiences unexplained pain, and only then do they seek help. At that point, a disease may have already taken hold, making treatment more difficult and complex. But what if we could shift that paradigm? What if we could find the earliest whispers of illness long before they become a shout? This is the promise of modern technology in healthcare. Finding diseases early, before symptoms even appear, is arguably the most significant advancement we can make in medicine. It transforms the entire landscape of treatment, turning a potential crisis into a manageable condition. It is the difference between fighting a raging fire and extinguishing a single spark. The core principle is simple. Nearly every major illness, from cancer to heart disease to neurodegenerative conditions like Alzheimer's, begins with microscopic changes in the body. These are subtle shifts at a cellular or molecular level that are completely invisible to us and cause no noticeable symptoms. Traditionally, we have had to wait for these changes to grow into a significant problem, a tumor large enough to be felt, or artery blockage severe enough to cause chest pain. Early detection technologies, however, are designed to be our microscopic eyes and ears. They are built to identify those initial, subtle signals, giving us a crucial head start. This early warning allows doctors to intervene when treatments are most effective and often less invasive. Imagine treating a tiny, localized cancer that can be removed with a simple procedure versus battling a cancer that has spread throughout the body. The outcomes are worlds apart. Similarly, identifying the earliest signs of heart disease allows for lifestyle changes and medications that can prevent a heart attack from ever happening. It's about being proactive rather than reactive. This shift doesn't just improve survival rates, it vastly improves a person's quality of life during and after treatment. It means less aggressive therapies, shorter recovery times, and a greater chance of returning to a full and healthy life. This is the fundamental goal we are all working toward in medicine. This proactive approach is no longer a distant dream, it is rapidly becoming our reality. We are entering an era where your annual checkup might involve more than just a stethoscope and a blood pressure cuff. It could include sophisticated data analysis and genetic screening that provides a detailed picture of your future health risks. This isn't about creating anxiety, it's about empowerment. It's about giving you and your doctor the knowledge needed to make informed decisions and take preventative action. The tools we are developing today are truly revolutionary, and they are poised to save countless lives by catching disease at its most vulnerable, the very beginning. At the forefront of this revolution are two powerful allies: artificial intelligence and the science of biomarkers. Artificial intelligence is acting as a digital detective, capable of analyzing medical data with a speed and precision that surpasses human ability. Think about a radiologist looking at a mammogram or a CT scan. They are trained to spot tiny abnormalities, but even the best trained eye can miss something. An artificial intelligence algorithm, however, can be trained on millions of scans. It learns to identify the most subtle patterns, pixels, and shadows that might indicate the earliest stage of a tumor, sometimes years before it would be visible to a human expert. This doesn't replace the doctor. It empowers them with a powerful second opinion. These artificial intelligence systems are not just for looking at images. They can also sift through vast amounts of data in a patient's electronic health record. They can connect the dots between lab results, doctor's notes, and personal history to flag individuals who might be at high risk for a developing condition. This computational power allows us to see trends and correlations that would be impossible to spot otherwise. For example, an artificial intelligence could analyze subtle changes in a person's blood work over several years and alert a physician that this patient is on a trajectory toward developing diabetes, allowing for early intervention with diet and exercise. It is a tireless assistant, working behind the scenes to protect our health. But what is the artificial intelligence looking for? Often, the answer is biomarkers. A biomarker is simply a measurable sign in the body that points to a particular disease or condition. Think of it as a clue left behind by an illness. A classic example is glucose in the blood, which is a biomarker for diabetes. Today, scientists are discovering far more sophisticated biomarkers. For cancer, this has led to a groundbreaking test called a liquid biopsy. Instead of surgically removing a piece of tissue to test for cancer, a liquid biopsy can find tiny fragments of DNA shed by tumors circulating in a simple blood sample. This is a game changer. This technology allows us to detect cancers like pancreatic or ovarian cancer, which often have no early symptoms and are notoriously difficult to find. A routine blood draw could one day screen for multiple types of cancer simultaneously, long before a person feels sick. These biomarkers are not just for cancer. Specific proteins in the blood may act as early warning signs for Alzheimer's disease, while other markers can indicate hidden inflammation that could lead to heart disease. By identifying and tracking these biomarkers, we get a direct window into the body's hidden processes, allowing us to act decisively and early. The power of early detection is also moving out of the hospital and into our daily lives. The smartwatch on your wrist or the fitness tracker you wear is no longer just for counting steps or tracking your workouts. These wearable devices have become sophisticated health monitors, collecting a continuous stream of data about your body. They can track your heart rate and rhythm, monitor your sleep patterns, measure your blood oxygen levels, and even perform an electrocardiogram. This constant monitoring provides a baseline of what is normal for you, making it easier to spot when something is wrong. An irregular heart rhythm detected by a watch could be the first sign of atrial fibrillation, a condition that significantly increases the risk of stroke. This technology empowers you to take an active role in your own health. The data collected by these devices can be shared with your doctor, providing them with a much richer, more detailed picture of your health than what they can gather from a 15-minute office visit. Imagine your doctor being able to see how your heart rate responded to stress over the past month, or how a new medication is affecting your sleep quality. This continuous stream of information is invaluable. It helps identify subtle but persistent issues that might otherwise go unnoticed until they become a serious problem. It's like having a health guardian with you 24 hours a day, 7 days a week. Beyond wearables, we are seeing a rise in at-home diagnostic tests. These are simple, user-friendly kits that allow you to test for various health conditions from the comfort of your home. We are already familiar with at-home tests for things like blood sugar or pregnancy, but the technology is expanding rapidly. There are now kits that can screen for colon cancer, check your cholesterol levels, or test for kidney function using a small urine or blood sample. This makes healthcare more accessible, especially for people who live in remote areas or have difficulty traveling to a clinic. It reduces the barriers to getting tested and encourages more frequent screening. This trend toward decentralized testing is making healthcare more convenient and patient-centered. The goal is not to replace doctors, but to provide them with more timely and frequent data. An at-home test that flags a potential issue can prompt a person to see their doctor for a more thorough evaluation. This combination of wearable technology and at-home diagnostics creates a powerful early warning system. It puts more information and control into the hands of the individual, fostering a partnership between patients and their healthcare providers. It is a proactive model of health that is built for the modern world, helping us stay one step ahead of disease. The potential of these technologies is immense, but as with any major innovation, there are challenges we must address. One of the most significant hurdles is accessibility and cost. These cutting-edge artificial intelligence analyses, liquid biopsies, and genetic screenings can be expensive. We must work to ensure that these life-saving tools are not just available to the wealthy. A two-tiered system where only some can afford early detection would worsen health disparities. We need to find ways to lower costs and ensure that insurance plans cover these preventative tests, making them a standard part of care for everyone, regardless of their income or where they live. Equity must be at the heart of this technological revolution. Another challenge lies in regulation and data privacy. How do we ensure these new tests and artificial intelligence algorithms are accurate, reliable, and safe? Government bodies like the Food and Drug Administration are working to create new frameworks for approving these complex technologies, but it's a rapidly evolving field. Furthermore, we are collecting more personal health data than ever before. We must have robust security measures and strict privacy rules in place to protect this sensitive information. Patients need to trust that their data is being used responsibly and will not be misused or fall into the wrong hands. Building and maintaining that trust is absolutely essential for these tools to be widely adopted. Furthermore, we need to educate both the public and healthcare professionals. Patients need to understand what these tests mean, how to interpret the results without undue anxiety, and what steps to take based on the findings. Doctors, nurses, and other providers also need ongoing training to keep up with these new tools and learn how to best integrate them into their practice. A test result is only useful if it leads to the right action. This requires a massive educational effort to ensure that the information we gain from technology is translated into better health outcomes. It's about turning data into wisdom and wisdom into action. Despite these challenges, the future of early disease detection is incredibly bright. These technologies represent a fundamental shift from treating sickness to preserving wellness. By finding diseases like cancer, heart disease, and diabetes at their earliest stages, we are not just extending lifespans. We are improving the quality of those years. We are giving people more time with their loved ones, free from the burden of chronic illness. The innovations we are seeing today are turning science fiction into medical fact. They are empowering patients and doctors alike, and they are, without a doubt, saving lives and building a healthier future for all of us. Thank you for watching.